Hello, everyone, and welcome to another edition of Project Table Talk, an educational series sponsored by the Fond du Lac Area Women's Fund. I'm Maria Turner, the Executive Director of the Women's Fund, and I'm joined here today by two guests. I have co-facilitator Kyle Jefferson, who is a member of our board of directors, and I also have Tiffany Fisher, who is our guest for today. She is a doctor of physical therapy and certified nutritional physical therapist at Advocate Aurora Health here in Fond du Lac, as well as a member of our board of directors too. So we're sharing the knowledge of our leadership here with the Women's Fund today with Kyle and Tiffany aboard. We are talking today, Tiffany, about Women's Health Month. May is Women's Health Month, which is recognized annually by the National U.S. Government Health and Human Services Office. And it's a time every year that they are encouraging women to pay attention to various things related to their health, because as nurturers, as caregivers, women often put their health needs secondary. And so this is a time and a month, and we're currently in National Women's Health Week, to really focus on this. So we thought it would be a great opportunity to have you come and discuss physical health. The Women's Fund has been focused the last several months on mental health leading up to our event that we had in April, but now we're going to shift gears a little bit and talk about physical health. And we thought having you as a doctor of physical therapy would be an interesting twist on women's health, because I think a lot of times we think OBGYNs or, that's kind of how our brains work when we immediately think of women's health. But in talking with you, I've already learned a few things that I thought would be wonderful to share with our listeners. So let's begin, Tiffany, with you telling us a little bit about physical therapy broadly. Like, what does it all encompass? How does that relate to women's health in general?
Okay, so there's a special area in physical therapy. I have my certificate of achievement in pelvic floor physical therapy, which makes me kind of an expert in the area of the pelvic floor. And men, women, children, we all have pelvic floors. But when we're talking about women specifically, what people don't realize is that pelvic floor is really what controls all bowel, bladder, and sexual function. So some issues that people have that they don't realize physical therapy can help with is bladder and bowel incontinence issues, urgency and frequency of bladder or bowel issues, pelvic pain, that's a big one, stool, and gas incontinence issues where people have uncontrollable, like where there could be some seepage and that they don't even realize that they've had with their stool, or just gas when they accidentally pass gas in public. That's a big one that people don't realize can be treated with physical therapy. Postpartum issues after babies, the diastasis recti, where their abdominal muscles separate. That's something that we treat for women. And any kind of abdominal pain, like post-surgical abdominal pain, is really associated with that pelvic floor as well. So back pain too, people don't realize can be associated with that weak pelvic floor and abdominal muscles.
Yeah, thank you, Tiffany. I didn't know much about pelvic floor until recently. I mean, I think we sat down, we talked about it, and just kind of understand that we all have it. It's either what you say, use it or lose it,
Yes.
type of thing. And I kind of took that to heart, right? And, doing different exercises to make sure that you keep that, pelvic floor strong and, different things. And especially in the sports world with young girls, they're the ones that typically run into some of those issues. But kind of just talk to us of, the pelvic floor and some of the issues that you've seen and, how does it fall under, physical therapy, and just kind of walk us through that.
So if somebody would come in and they were having issues, we would do a full evaluation, including an evaluation of their pelvic floor muscles. So people have been really familiar with the term Kegel's muscles, and those are the Kegel muscles are the pelvic floor muscles. So I assess the pelvic floor, and I always kind of say I'm the personal trainer for the pelvic floor. So I come up with a home program that's specific to my patient's pelvic floor at that time. So it's not guessing on how much weight, how much resistance. Like when you go to the gym, you don't really know exactly. Not everybody uses the same weights on the equipment. So that's kind of what I do with their pelvic floor muscles as well. Determine what they need for a home program to see success.
This is really interesting for me because, again, when you talk about pelvic floor, I think that any woman who's a mother, we have potentially, at least for a brief period of time after, if you had a vaginal birth in particular, but maybe also for a C-section, probably more so, I'm guessing, because it's cutting into those abdominal muscles. So, I think that there's a natural connection to that for women that have had children. But tell me a little bit, you and I had discussed the idea that at least half of the patients that come in to you are not mothers and are experiencing issues with their pelvic floor. So let's walk through that a little bit. Like, what might that look like, and how does that happen? Because I think, again, we naturally associate childbirth with some of these pelvic floor issues, especially for women. So what about the women that aren't mothers?
Correct. So what you were just mentioning, when patients come in, sometimes it's after an abdominal surgery. And then what we talked about was how the abdominals and the pelvic floor kind of work together as a team. So that can leave them susceptible to more of those pelvic floor symptoms, just like a cesarean section, delivery, same thing. But also it could be something such as working in a job where they do a lot of heavy lifting, or horseback riding, where there really a lot of bouncing of their organs. And the other one that's really not usually something people like to talk about, but that I see a lot in my clinic, is a history of sexual abuse. And so that's something that with my, the population, the younger population, I'm always kind of looking for red flags if I'm seeing children for incontinence issues. But in adults, what I see more often than not is actually a history of sexual abuse in my pelvic pain patients, specifically the patients that have pain with intercourse as adults. And what we find is that it's actually, there's that 100% of pain comes from the brain. So they actually associate intercourse with that event. And sometimes they don't even realize that there's a connection. And it really does kind of come back to haunt them in the future if they haven't dealt with that through behavioral health.
I think you mentioned a referral or something. Someone was working with behavioral health and then came to you, and this connection with the sexual abuse came up, as that. And, when you and I talked about that, that really struck me because of the work we're doing surrounding Fond du Lac Says No More, and working toward educating about just the ripple effects of sexual assault, domestic violence, some of these things. And so I'm really glad we're having that conversation, because I think if you're a woman and you're experiencing that, there's a shame, and you may not make that connection to that past trauma, especially if it occurred and maybe you repressed it in your childhood or something of that nature. So I'm really grateful that you're bringing that point forward. Kyle.
Wow. Just to realize that you do so much, and it ties back into sexual abuse is huge, right? I didn't realize how impactful, like, the work that you do every day can impact and save someone's life, especially in a sexual abuse category, right? We're all trying to protect women. And I didn't realize that's another way that we can protect women, is by some of the work that you do and the things that you're looking for day in and day out when you're doing your diagnostics. Just to kind of stay on the pelvic floor, is there any other symptoms or any other experience women might relate to, or things that you may see from a pelvic floor standpoint?
Well, lately what I'm seeing is a lot of my coworkers are referring their chronic hip pain or back pain patients to me when they're not getting better with just the standard physical therapy that they're used to having when they have just back pain or hip pain. And I'm seeing a lot of success with those patients as well. Those patients that maybe had some deep hip pain, it may be related to actually a hip muscle that is located along the pelvic floor that when I'm doing my treatment, I can get to and release and actually give patients a lot of relief. Also that, if you think of the pelvic floor as being the floor of the core, we know that with back pain, you need a strong core. So really associating that pelvic floor and the strength in that pelvic floor with the abdominal work and the core training really can make a difference and finally give those patients the relief that they're looking for long-term.
Mhm. So Tiffany, let's talk a little bit about what types of exercises. I know that when we were conversing prior to this show, I had said that I often think of physical therapy as a sports injury occurred and then we go and we get particular exercises. I'm sure this looks a little bit different. Walk us through what some of those exercises might look like, how often a patient might have to do them, just kind of and I know not everyone is the same, right? But in a typical scenario, what would that look like?
Well, the handout that I give the patients actually has a couple blanks. It has do this many contractions, this many times a day, and I fill in those blanks according to their evaluation. Once I evaluate them and see how long can they squeeze their muscles, how many repetitions can they do successfully with good quality, how many quick squeezes can they do, and are they good quality quick squeezes? Are they able to relax their muscles? So when we come up with, that's those Kegel muscles that people think of, and that's the pelvic floor strengthening. So there's quick squeeze muscles and then endurance muscles. So there's two different subgroups that they're working on at home once I come up with that home program. But the other concern is with giving somebody pelvic floor muscle exercises without assessing them, if they have what's called high tone pelvic floor, which means their muscles aren't able to relax, then they're going to actually make their symptoms worse and cause them maybe urinary retention or more pain with intercourse. And so that's why it's so important to have an actual examination to determine what's going on with those pelvic floor muscles, because that really can cause a problem if we start having somebody strengthen something that's already tight, or too tight, I should say.
Mm.
And so, and the other one, actually, go back to the core, you were asking about the rest of those. The core exercises, I have 4 standard core exercises I like to give to my patients. And specifically, the core exercises I give are specific to the transversus abdominis muscle. And I have them really focusing on the deep muscle of their abdomen and really working on how to brace the spine and that pelvic floor as a team.
Sweet, thank you. I'm super happy. Like, I can just point it. Like, I get the pleasure. I get to work with you every day. I get to see the work that you do, the inside and out. Like, we've had conversations about a lot of different things. You've done a lot of presentations in the community. And I want to say thank you, right? I think those presentations bring light to a lot of things that people don't know, just like the core exercises, right? You talk about that. I hope you can send those to me when this is over, because those are exercises that I would like to give. I would like to do myself, as well as I would like to give to some of my young athletes to do as well, to make sure that they're properly having a strong core. But yeah, that's all I got. I appreciate you. Thank you. Thank you for us being a part and working on the same team.
Well, I love community presentations because it just gets the word out and people to understand that there's something they can do about these issues, because that's why we're here today. People don't even realize that this isn't normal, that you don't have to live with incontinence and pelvic pain and all these issues, that there's something that can be done, and it's actually very easy to do. And it's something I could be working on right now as we're doing this talk, and people don't even know I'm doing it. So it's one of those things that, everybody should be doing every day.
Okay, I'm not gonna lie. I did do a couple of Kegels during this presentation, right?
My
And
transverse abdominis is activated.
Some of our listeners did too, right? Like, so that's why we're here. We're reminding women to be mindful in the moment. We're talking about something we all can do, like you said, when no one is aware of that. So I love that. And yes, to piggyback a little bit on what Kyle said, the two of you were instrumental in providing some community education through Advocate Aurora Health in partnership with the YMCA of Fond du Lac, as well as TNT Fitness, over the last several months. And, I think those types of presentations, getting out to public in spaces where they don't have to try very hard to get the information, right? They're already coming to the gym. They're already going to be there to do something else. Like, excellent work to both of you for facilitating and coordinating that, because that is the type of thing that nonprofits can do in collaboration with healthcare and people like the Women's Fund as a nonprofit that's about community education, can work to get the word out about it. So I appreciate that immensely. So we are at the end of this particular conversation. Thank you both for coming today. I'm appreciative to you, Tiffany, for walking us through the aspects of physical therapy that I think a lot of people were not aware of, and very relevant to Women's Health Month. We will be here again on Thursday, May 26th, for a conversation on foster care and the dire need for foster care parents here in Fond du Lac County. May is Foster Care Awareness Month, and so we are wanting to shine a spotlight on that community need as well. As it especially fits in with our Fond du Lac Says No More initiative too. So thank you again for coming. We appreciate it. And thank you to all of our listeners for tuning in today. See you soon.